Breast enhancement. So breast enhancement to me is really three kind of separate categories depending upon your need. And some of them sound opposite of each other. The most common one is breast augmentation or breast enlargement or breast implants. Some people would say things like boob job. So that basically means we're making the breasts larger using surgical techniques. So to most people, that's an implant. There are other ways, but we'll discuss implants first. In general, we're going to use an implant that has a silicone shell that is solid. And we're either going to use saline, which is just salt water, or we're going to use a silicone gel. And there's different levels of cohesivity of silicone gel. Cohesivity is how thick and well stuck together the silicone gel is. In the 80s, early 90s, back when silicone implants were pulled off the market, there was a lot of silicone that was very liquidy, almost like vegetable oil. And while it felt good, a lot of times it was too soft, but more importantly, it was not really meant to stick together. So they were more prone to leaking. So as most people know, silicone implants were pulled off the market between 1996 and 2006 by the FDA. This was based on some possibilities that was related to autoimmune diseases. We've determined that there's really not a significantly higher risk of autoimmune diseases in patients with breast implants. So they were re-released. But the really great thing that came out of that is that the silicone implants made today are extremely well researched. A lot of research and development, or R&D money, was spent by companies that were willing to go through this process and really reach a onerously high pinnacle to get approval for breast augmentation with silicone implants. Small companies couldn't do it, and these big companies really spent a lot of money to make a nice, safe implant for us. And we have a variety of options now. They're all what I consider cohesive, but when people use the word gummy bear, they're talking about the truly most cohesive implants. Some people, that's too firm. So we have all three options to discuss with patients, kind of the softest to the firmest, and we'll make different recommendations. We still use saline implants. That's filled with salt water, and if they leak, it's no big deal. They don't tend to feel quite as natural, but we do use those a lot as well. And we're going to place those implants where they're most needed to be placed. Usually that's under the muscle, sometimes on top of the muscle. We can go in through a variety of incisions. There's really 4 incisions that have been described, 5 I guess. One is to go underneath the breast, sneaking in the fold of your breast, trying to minimize as little travel through other tissues as possible. Get in through the skin, under the fat, under the breast, and get the implant in. That's usually my preferred approach. I also will frequently do the periareolar approach. That's putting the implant in around the nipple, usually on the underneath side. And it's a really nice approach because you can hide the scar. And we just do that in certain times. The third one that I do commonly is just through the breast lift. If I'm doing a breast lift at the same time, there's different ways I can go in that are going to be part of the existing incision anyway that I'll kind of do. The fourth way is through the armpit. This is called a transaxillary breast augmentation. The advantage of this is having no scar on the actual breast. You do have a scar in your armpit. It's usually very well hidden. There's a few extra issues, a little bit higher rate of capsular contracture, a little bit higher risk of infection with that procedure. So it's not one I do that commonly, but I do it when it's appropriate and when the patient needs it or desires it. And then the fifth option, which I completely don't agree with, is going through the belly button. Some people call that a tuba or a transumbilical breast augmentation. You can only do it with saline implants. You have to use a special tube to put it in. It voids the warranty of all the implants, and you're really not able to see what you're doing well enough for me to like it. So that's kind of breast augmentation in a nutshell. The implants typically last, on average 10 years, but I've seen them go 20 to 30, and we will discuss all that with you in person. The other things we'll do is either a breast lift, and in some people a breast reduction. If your breasts are saggy, or the nipple's too low, or things aren't shaped how you want, we may need a mastopexy, which is the medical term for a breast lift. Sometimes we even do a breast lift when the nipple's position is fine, but the bottom of the breast is bottoming out, and that's we call that pseudotosis, and we can correct that with the breast lift. Breast reduction is basically a breast lift when we make the breast smaller as well, and those can range from needing to go a little bit smaller to a whole lot smaller. In kind of that medium and large range, we may even get to where insurance criteria are met for breast reduction. The more weight you remove, the more relief you're going to get from some potentially common musculoskeletal issues you can get with large breasts, such as back pain, neck pain, shoulder pain, grooves in the shoulders. even headaches. But I've even seen patients get the same amount of relief from a breast lift as a breast reduction. So just because insurance doesn't cover it and it's not a medically necessary procedure doesn't mean that it's not going to have a lot of medical benefits. So I spent a lot of my life helping patients with the breasts, making them happier with them, making them look better. It's one of my favorite things to do, and would be happy to talk to you about it.